We look forward to the board members welcoming our special guest this evening, from the Linz Association. And again, the meeting evolved from a motion that was put forth many months ago in regards to potentially a task force for long-term care. And obviously it's not a secret, it's become a subject in our community, and we want to thank you first and foremost for attending this evening. And if anything, we're looking for an evening where we're going to have a lot of answers and questions. And again, it's more of a fact-finding mission for all of us, and we respect and thank you for taking the time out of your busy schedule to come and share your thoughts about our community with our board members as well as our extended guests. So again, I thank you very much. And at this point, can I have a mover for the agenda? Gary, and second by Marcel. All in favor? Thank you. And also any disclosure of conflict of interest by the board members? Seeing none, we'll move on. And at this point, again, I want to say thank you to our special guests and turn over to Dr. Paul.
Thank you very much, and again, welcome back to 2013 board sessions, and to our guests as well. It's with great pleasure that I'm able to introduce our guest today. As you know, public health itself has been very much involved with a lot of the demographic, material surveillance, and so on, in partnership and stakeholders in relationship building for many years. And one of the challenges that we had as a board was that we are not strictly part of the link. We are independent board of health that are directly working with the ministry and funded in a different model than the rest of healthcare institutions. But despite that, we think it's very important for us to work, and we share common goals. We serve the same population. We look at it from a population health point of view, and from a prevention and health promotion aspect, and a surveillance and demographic aspect as well. And we recognize that that's an important and fundamental part of being well, but we also recognize there's the acute care spectrum, and there should not be a disconnect. You know, on paper there's a bit of a disconnect organizationally, but functionally there really isn't. And I'm very happy to say that, you know, over the last couple of years, I have enjoyed personally a very good relationship with our local LIN, with their predecessors as well. And at a provincial level, we have been working together initially with other LIN CEOs, and now with Chantal, looking at how LINs and public health can better collaborate, not better, more collaborate, align services, look at common goals, and look at where each stakeholder fits. And not only with the fact that we're working just with the LINs, and the LINs do represent a wide spectrum of health care. The other important part is that as public health experts and public health practitioners, we have a whole list of community partners, and just by the way that our health unit board is made up, you can see that we have municipal appointees here, we have provincial representatives, and so we have a perspective that really puts us into, you know, perhaps a venue that LINs and acute care institutions don't have the opportunity. We do have that opportunity, and so I think there's a synergistic opportunities to work together. And having said that, you know, we've isolated quite a lot of issues, and as you know, the population of the Eastern Ontario itself is disadvantaged in terms of the social determinants of health, health status, and so on. And we share a lot of that information. We provide a lot of information. As a matter of fact, we are on one of your several committees of the LIN, looking at the numbers and demographics of the area, because it's important to be able to plan and accordingly serve your population in a way that is dictated by evidence, and your evidence is your surveillance and your needs, and that differs differently than. And one of the I think one of the challenges that the Champlain LIN has is so big. You know, Ottawa has a different demographic than we do, and Pembroke has a different demographic than we do as well. And one of the things that I like very much about the approach that the Champlain LIN has been taking is that they've been paying attention to regional needs. Looking at our regional needs, we have a task force, community advisory task force that I co-chair. It has a multitude of partners that work together, inform the LIN. We actually co-chaired, as you chaired, actually, Mayor chaired, the Clinical Services Steering Committee that looked at clinical services across eastern counties. And so we've had a relationship that we're, you know, building on and trying to foster, and actually both locally and at the provincial level. Wearing my hat as president of the Association of Local Public Health Agencies, I've worked directly with the Deputy Minister and the Minister themselves, and they themselves too see that it's very valuable for us to work together. And one of the obvious things that we're looking at when we're looking at demographics, and you know I'm a pediatrician, so I think we have pediatric issues as well, but the other end of the spectrum as well is the seniors issue. If we look at our demographics, we look at, and it's no surprise to anybody that we are going to be having an increased burden of the aging baby boomers and so on. And so these are issues to us that, you know, as from our point of view, as stakeholders in sort of population health, are important for us to know and to share and to work with others and do our part. We do health promotion, we do health prevention, and some of our members here, you know, in March wanted to look at some of the senior strategies. It spun off initially as an idea of the Cornwall Hospital and so on, but I think, and I shared it with the board at that time, and I still share it, is that yes, I think it's important to look at an overall strategy, an overall picture of what we can expect and how we can react collectively, not only for Cornwall, SDG, and Prescott Russell, the whole area that the Eastern Ontario Health Board represents. And so I think it's valuable that you're here to look at that as well, you know, address a specific issue, but I want people to know that we're looking at aging strategies, senior strategies, and I know you're going to talk about it a bit, Chantal, but yesterday there was a report from the ministry, Living Longer, Living Well, which was basically done by Dr. Samir Sina. He was the provincial lead on the Ontario Senior Strategy, and as a matter of fact, we consulted with him, he consulted with a multitude of partners and stakeholders, and came out with a very, very comprehensive list of recommendations that if you look through, there's parts for everybody, you know, and it starts off with really something that is dear to our hearts, looking at basically the social determinants of health, talking about promoting health and wellness, looking at poverty reduction as part of the strategy of looking at seniors, strengthening primary care, and so on. I know that Chantal's going to talk a bit about that as well. And in the end, it talks about how we implement this, and talks about looking at committees and looking at exactly what we're doing. You know, putting stakeholders together from public health and other to be able to collectively do that. And I like to think that today's exercise, an information session, is a way of doing it. I know that we have a local issue question, but as well, I think that as a board, we need to, and we'll welcome some of the information that you're going to share with us. So, without further ado, I would like to welcome and present Chantal Leclerc, who now is the Lynn CEO, Champlain Lynn CEO for almost a year now.
March.
Almost a year. And I thank her for coming. We've had a very busy day today. As you know, we're in the middle of a flu outbreak in the area, and Chantal had to a teleconference with all the hospitals and all of the public health across the Champlain Linns today. Busy time, however, very valuable to have you here and present information.
Well,